anti-angiogenic treatment. Then the immunohistochemistry, genomics, these procedures have improved the exact diagnosis of cancer.
Sir, in English. Yeah.
English. So I am a medical oncologist from Samprada Cancer Hospital. Now there are a lot of advances which have taken place in cancer diagnosis and cancer management. One is staging of cancer has become much more specific. For example, PET scan, whole body is shown in one image, and we know what is the primary cancer and to what are organs the cancer has spread. So staging will immediately be known because of this investigation. In addition to the cancer localization, we will also know the metabolic activity of cancer, which will tell us about the biology of cancer, whether it is good or bad and all that. Histopathology and biopsy procedures have become much more specific, much is facilitated by repeat genomic testing in these cancer patients. So it is prolonging the survival and increasing the life expectancy of cancer patients, which was about 6 to 9 months in a stage 4 cancer earlier, and now can be anywhere between 5 to 7 years. So that is the kind of improvement which has taken place. In addition to this, surgical techniques have improved, radiotherapy techniques have improved, the palliative care of the cancer patients, where we cannot offer any anti-cancer treatment, also has improved. The better painkillers have come and better supportive care for cancer patients has happened.
Thank you, sir.
Thanks.
See, the
in English,
pregnancy care, whether it is for working women who is not working woman, the protocol is same. Protocol is to make sure that pregnancy is healthy, mother is safe, baby is safe. ಸೊ ಅದಕ್ಕೆ ಹಲವಾರು ಆ್ಯಂಟಿನೇಟಲ್ ಕೇರ್ ಅಂತ ಹೇಳ್ತಾರೆ. ಅಂದರೆ ಒಂದು 7 ತಿಂಗಳ ತನಕ ತಿಂಗಳಿಗೆ ಒಮ್ಮೆ ಆದರೂ ಬರಬೇಕು ಅವರು ಚೆಕಪ್ಗೆ. 7ರಿಂದ 9ನೇ ತಿಂಗಳ ತನಕ 15 ದಿನಕ್ಕೊಮ್ಮೆ ಆದರೂ ಚೆಕಪ್ಗೆ ಬರಬೇಕು. ಯಾಕೆಂದರೆ 7 ತಿಂಗಳು ಆದಮೇಲೆ ಸಡನ್ನಾಗಿ ಬಿ ಪಿ ಜಾಸ್ತಿ ಆಗೋದು, ಶುಗರ್ ಜಾಸ್ತಿ ಆಗೋದು, ಗ್ರೋತ್ ಅಬ್ನಾರ್ಮಲಿಟಿ ಆಫ್ ದ ಬೇಬಿ ಅದೆಲ್ಲ ತುಂಬ ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಸೊ ವಿ ಇನ್ಕ್ರೀಸ್ ದ ಫ್ರೀಕ್ವೆನ್ಸಿ ಆಫ್ ಮಾನಿಟರಿಂಗ್ ದ ಬೇಬಿ ಆ್ಯಂಡ್ ಫೀಟಸ್. ಸೊ ದ 9th ಮಂತಲ್ಲಿ ನಿಯರಿಂಗ್ ಡೆಲಿವರಿ ಅದರ್ ಥಿಂಗ್ಸ್ ವಿಲ್ ಕ್ರಾಪ್ ಅಪ್. ಸಡನ್ನಾಗಿ ಬೇಬಿದು ಆ್ಯಕ್ಟಿವಿಟಿ ವೆಲ್ಬೀಯಿಂಗ್ ಏನಾದ್ರು ಕಡಿಮೆ ಆಗುತ್ತಾ, ಡೆಲಿವರಿ ಯಾವ ಟೈಮಿಗೆ ಮಾಡೋದು, ಅದರದ್ದೆಲ್ಲ ಒಂದು ನಿಷ್ಕರ್ಷೆ ಎಲ್ಲ ಆಗಬೇಕಾಗುತ್ತೆ. ಸೊ ಅದರಿಂದ 36 ವಾರ ಆದಮೇಲೆ ಎವ್ರಿ ವೀಕ್ ಬರಬೇಕು ಅವರು.
Yes, ma'am. Yeah. So NIPT and the latest developments in the prenatal screening.
So see, when a woman gets pregnant, during her pregnancy, she has to undergo screening, maternal screening. But what happens with the routine blood tests, you can get false positive also. So you'll get a high risk, when actually the baby is fine. So the whole idea is to find the special children, but not overdiagnose, not underdiagnose. Just find the special children and do the medical termination of pregnancy after confirming, but not to over or under that. So where NIPT helps us, it's got 99.9% sensitivity and specificity. So as the other doctors also shared that as compared to a 5% false positivity, you get actual positivity of just less than 0.5%, and that is a very big change, and it can help a lot of pregnant women. And what Metropolis has done is that we have clubbed this NIPT with a test called Prega Screen. We have launched Prega Screen, for which we won an award also, in which we screen all the women, all the pregnant women, and if they are not low risk, if they are high risk or intermediate risk, we tell them we can do NIPT or invasive testing free of cost. And this gives them full confidence, and at very low cost they can be sure that the baby is going to be born healthy and well. Join the WHO and the Indian government narrative in reducing or eradicating tuberculosis from this country. And along similar lines, as I mentioned, now we are going across this gynecology and this oncology segment to help over there. And the way we've done public-private partnerships for infectious and other diseases, we will now do for these two segments as well.
Hi, I am Dr. Ravi Kumar, the Vice President, Karnataka Operations, also Chief of the Lab at RV Metropolis Bangalore. Today we had a launch of what is called as molecular genomics in Bangalore. This molecular genomics is about the genetic test in different diseases, how to prevent, how to diagnose and how to treat also, which is important for some of the diseases, especially the cancer disease. That is very, very important. That's the gene testing actually. And we are present in Bangalore in most of the places. We have a main lab at RV Metropolis, that is in Malleshwaram. We are also doing our HLM, that is Hospital Laboratory Management at Ramaya Memorial Hospital, Bangalore. We also acquired one lab called Central Lab at Bangalore, which is at Richmond Circle. Apart from all this, we have 12 other satellite labs, not only in Bangalore, in Mangalore, in Mysore, in Belagaum, in Tumkur, and all this. Kolar also we have one now, recently started. And apart from this, we have 82 collection points or centers. We call it as different names, but all these are available throughout Karnataka. So in the near future, we want to have more number of these centers coming up in most of the districts. Okay, not only in Bangalore we want to expand in other places also. Maybe if you talk about Bangalore, we want to talk more about the regular health checkup, what is very important for current stress related problems to all kinds of communities, I would say. When I say community, it is not only the IT communities, all the other communities who are working very hard, getting some sort of stress, where the routine health check would play a very, very important role. That we want to bring it to all corners of the Bangalore city. At the same time, we want to expand in other cities also where we are not present. Example, we are not present there, for example, in Hubli. We want to start something in Hubli. Okay, already we have in Belagaum, but we are not having anything in Hubli. We want to start. Already we are finding some, what you call infrastructure is going on in Hubli to start a laboratory. So like that, we want to expand in each every district. Apart from the district, we want to go into the neighboring part of these districts, so that everybody in Karnataka, even a small village, should get the benefit of the test that is available at Metropolis. Today, Metropolis is one of the largest laboratories which has a network not only in India, even in abroad also. We are there in almost in 6 countries apart from India. And then this, how do you reach? Because of the networking. So already I told you, we have a global laboratory at Mumbai. Then we call it as regional reference laboratory in major cities in India. Then we have satellite labs, and then we have collection centers. This is how we spread ourselves so that it will reach to the nook and corner of all the cities in India, and also it reaches the villages. So that is our plan. And what we want to do, basically, we want to portray ourselves as one of the scientific brand, because that's why this launch is all about. Because we don't want to go into the market just saying that we are doing that, we are doing this. No, but we want to say scientifically what we are doing. So this laboratory has got a scientific approach. Example, today we are launched. So what is the launch about? Why we should do this? What is the advantage people are going to get? What is that they want to prevent some of the things? For example, NIPT. All the pregnant women has to go through this NIPT because it has a 99% specificity. It's a very specific test compared to the earlier test. So this is what the Metropolis is looking at. Go to some of the important testing areas, do specific tests which are important today, rather than doing the old related tests. So this is the mantra that we are going to follow in the future to ensure that the patient or the people, even at the village level, they get the proper diagnosis first. Okay.
Thank you, sir.
Thank you. Partnerships. So all this is going on. For example, if you ask me, we are already with the government services. Now we are giving service to all the patients from central government under CGHS scheme. Already is there. So a person who is a part of a village person who is having mother and father who is a government employee, he will get all the benefits free of cost. through us. The government is taking help from us. We are already providing the services. Only thing is people do not know about it. So we wanted to publish all that to the people of Karnataka.